Okay, welcome to all. We are so pleased to welcome you to the January webinar for the National Center on Advancing Person-Centered Practices and Systems. Everyone can self-direct. Lessons learned from the NCAPPS Self-Direction Learning Collaborative. I will begin by introducing myself and giving you a brief visual description. My name is Bevan Croft. I am a white, middle-aged woman with long blonde hair. I'm wearing gold hoop earrings and a purple velvet top. And behind my shoulder are various plants that live in my home office. I am a co-director of the National Center on Advancing Person-Centered Practices and Systems, along with colleague Sashka, who you will see interacting with you on chat. We are very grateful to have support from the Administration for Community Living and the Centers for Medicare and Medicaid Services to administer NCAPPS through the Human Services Research Institute. These webinars are always free and always open to the public. I will walk us through a few webinar logistics, and then we will meet the presenters and get going. So the purpose of NCAPPS is to promote systems change that makes person-centered principles not just an aspiration, but a reality in people's lives. We have a number of priorities at NCAPPS that hopefully you'll see come through today. Those include centering lived experience, partnership with advocacy communities, cultural humility and competence, a commitment to principles of disability justice and racial equity, which are essential for person-centered systems, as well as the power of cross-system collaboration for improvement. Next slide, please. A few logistics to run over with you. This webinar is a webinar format, so everyone is muted. You are more than welcome to participate via chat with the community. I'm already seeing folks saying hello and seeing all the wonderful places you're coming from. If you would like to participate in chat, remember to select everyone if you'd like all of the participants on the webinar to see your message. If you'd like to just chat with us, you'll select hosts and panelists to chat just with us. You're welcome to use chat to interact with one another, as well as to pose questions to our panelists, and we'll get to as many questions as we can at the end of the session. This webinar is being live captioned in English, and it is being live interpreted in Spanish. You can access the captioning by clicking the CC button at the bottom of your Zoom screen for the English captioning. And for the Spanish interpretation, you'll click Interpretation, which is the globe icon. And then once you're in the Spanish channel, please silence the original audio. There are just a couple of polls in this webinar and evaluation questions at the end. So please be prepared to interact when they pop up. If you have any follow-up questions or would like to get in touch with us, you're welcome to email us at ncapps@hsri.org. Just note that we won't be monitoring that address during this webinar. Let's see, the slides are available to you. You can download them with the link that Sashka has been putting into chat. And we will also put slides and a recording of this webinar on our website within a few weeks. So let's find out who is here. When the poll pops up on your screen, please indicate which roles you self-identify. This is a select all that apply because folks have many roles often. And if there's a role that you don't see here, you can put it into chat. And while people are responding, I will read the roles that are available: a person with a disability or a person who uses long-term services and supports, a family member or loved one of someone who uses long-term services and supports, self-advocate or advocate, peer specialist or peer mentor, social worker, counselor, or care manager, a research analyst, a community or faith-based service provider organization employee, or a government employee. So please indicate what roles you have. And in chat, I see we have some support brokers. Fantastic. We have some people from managed care organizations, and a number of other roles. So welcome. We're so glad that you're here. And let's see. I will give folks just another moment. We've got a very nice rate of participation here. Okay. Let's see the results. All right, I see about a quarter of you are social workers, counselors, or care managers, and also about a quarter are family members. And then we have good representation across various other roles today. Oh, and a third are government employees. So great, welcome. Lots of experience to bring today. So thank you. All right. Without further ado, I will introduce our panelists. We have a wonderful lineup of folks today. We'll start by hearing from Valerie Bradley, who is the founder and president emerita of the company that I'm so proud to work for, the Human Services Research Institute. Val has devoted her entire career to strengthening services, improving programs, and informing policy, all as an early and staunch advocate for the direct participation of people with disabilities. Next, we'll hear from a group of folks at the Colorado Department of Healthcare Policy and Financing. I believe that our acronym is pronounced HCPF. We'll hear from Jessica Corral. She's the Colorado Department of Healthcare Policy and Financing contract specialist for participant-directed programs. Jessica believes in the power of communities and collaborating with state agencies to create sustainable policies. We will also hear from Emily Harvey, who is the in-home support services policy advisor at the Colorado HCPF. 2 decades of direct care experience and over a decade of leadership experience have shaped Emily's belief that people can thrive in life when provided with appropriate resources and supports. And rounding out the Colorado team, we will hear from Oliver Giminero. Oliver has lived with a C4 spinal cord injury for the last 32 years. And during these 3 decades, he's continued to educate himself and others, sharing his experiences and knowledge of disability awareness and advocacy. He now serves as co-chair of the Direct Care Workforce Collaborative. After we hear from Colorado, we will move east to Ohio, and we will hear from Dana Charlton, who is the director of the Ohio Self-Determination Association, which is a nonprofit policy advocacy organization in Ohio. Prior experience was as a teacher in a state institution, and then as the deputy director of the Ohio Department of Developmental Disabilities, providing technical assistance, provider licensing, certification, management of interagency agreements, rule development, and self-determination initiatives. We'll also hear from Lisa Combs, who is the Service and Support Advisor for the Ohio Association of County Boards of Developmental Disabilities. Lisa is passionate about self-determination, person-centered planning, self-directed services, and supporting people with disabilities and their families in the aging process. Her passions come from her work, experience, and role as a mother of 4 adult children, including one with significant developmental disabilities who is 25 years old. So looking forward to having you meet all of these wonderful panelists. But first, I will turn things over to my NCAPPS co-director, Sashka, who will walk you through what this learning collaborative was all about.
All right. Thank you so much, Bevan. And thank you all for being here today for what is sure to be a wonderful webinar. So as Bevan mentioned, my name is Sashka. I co-direct NCAPPS. I am a white woman with sort of medium length brown hair, brown eyes. I'm wearing a black long sleeve top. I am sitting in my home office, which has, sort of white walls and then a long corner window over here. And earlier today, it was just snowing buckets and buckets. And maybe that is the case where you're at as well. Although I do hope you have better weather than I do. So I'm going to go pretty quickly through these next couple of slides today. I want to make sure that you have enough time to hear from all of our panelists and that we can get to a really robust Q&A session. But of course, we also wanted to make sure that we set the foundation for the webinar and that you are all aware of what the NCAPPS Self-Direction Learning Collaborative was and how that has impacted and influenced the teams who are on the webinar today. So first, we wanted to talk about what we mean when we say self-direction, because oftentimes we hear self-direction used as a concept, right? So people should be able to self-direct their lives, as an example. So that's more conceptual. But what we're really talking about today when we say self-direction is we're referring to a service model for people who are using home and community-based services. And so on the screen at the moment, there is a great definition of self-direction from our friends over at Applied Self-Direction. And the definition reads, self-direction is a model of long-term care service delivery that helps people of all ages with all types of disabilities maintain their independence at home. When a person self-directs, they decide how, when, and from whom their services and supports will be delivered. As a model, self-direction prioritizes participant choice, control, and flexibility, and this contrasts with traditional services received from an agency, where the agency controls most aspects of service delivery, including who will provide the service. In self-direction, the participant selects and trains their own staff, develops their staff schedules, and sets their own standards for how their services will be delivered. So let's go ahead to the next slide. So here at NCAPPS, where we focus on person-centered thinking, planning, and practice, we believe that self-direction is truly the most person-centered service model out there, because as noted, based off of the definition on the last slide, it really gives people direct control over the way that they are receiving services and how those services are delivered. Okay, let's go ahead to the next slide. So there are so many different benefits to self-direction. During the COVID-19 pandemic, we saw an increase in the use of self-directed services because people wanted to be able to ensure that their health and safety was preserved. And self-direction as a model gave that control to people using long-term services and supports over who was coming in and out of their homes and providing services to them, and also what policies they were following during the pandemic as it relates to, masking, testing, vaccination, and so on. We also know that the direct support workforce shortage was further exacerbated during the pandemic. And so the ability to hire family members or neighbors, people that you trust, was critical to ensuring that people were able to consistently receive the supports and services that they needed. And self-direction as a service model also allows for the very specific tailoring of services. And because of this, self-direction can really position people receiving services as the ultimate decision makers of their lives and help build a support system that works best for that person and what it is that they're looking for and ultimately hoping to achieve at the end of the day. All right, we'll head over to the next slide. And I'll give it a minute while our ASL interpreters switch here. Okay, perfect. So despite all of the benefits of self-direction, what we found in the National Core Indicators data from their 2020 to 2021 in-person survey is that only 18% of respondents were self-directing. And across the United States, we see such a range when it comes to how many people are self-directing, with some states having as low as 1% of people self-directing their home and community-based services, upwards of 55% in other states. So that is obviously a dramatic difference just across states in terms of how many people are self-directing. And I'm going to throw out a little bit of a lesson learned here in that there really is no roadmap for self-direction, because across states, policies, procedures, what one program can do versus what another can't, it's all so different. But within those differences, we here at NCAPPS saw an opportunity to have states learn from each other about what was even possible. What is one state doing that maybe we've never even considered, or how could we position ourselves to do X, Y, Z that this other state is doing and getting great outcomes from. And so we're going to head over to the next slide. So we at NCAPPS decided that there was a real need for a national effort to expand the quality and availability of self-direction as a person-centered option. And so from April 2022 to September of 2023, we brought together teams from across the country and experts to learn from each other as they work to improve the availability, quality, and access to self-direction, with the core belief that everyone can self-direct. We just need to make it possible. So that's where our webinar title comes from. And so our Learning Collaborative brought together 22 teams from 16 states, and that included over 200 participants. And those teams included state representatives, community advocates, people with lived experience of self-directing, and family members. All right, and on your screen is a map of the different state teams that participated. And I'm not going to read through all of those. I have done that before, but I'm not going to do that on this webinar. But we can always provide you with a list of those states if you are curious. Let's go to the next slide. Okay. So this is a little bit of some engagement that we want to do with you all in the audience today, which is, what are some challenges to enhancing and expanding self-direction that you've experienced in your own states, or perhaps even in your own countries? I know there's some international folks joining us today, but also, are there any success stories that you would really like to share? Any resources, things that you want to make people aware of? So that's one chat prompt that we're a little bit curious about. Another question that we have for you is, if you could wave a magic wand, what would you wish for to fix self-direction, whether it's in your state or in your country? So just wanting to hear from all of you and the different perspectives that you're bringing to the table today. You can choose to answer one question, both, whatever you feel. And I'm just pausing so we can get a couple of responses in. So Sharon noted no waiver for self-direction in Illinois. People or guardians don't really have knowledge of how to self-direct. Some comments regarding sustainability, how it can be difficult to kind of, it's one thing to start a self-direction program, it's another thing to sustain it. I'm seeing some additional themes around just education, people knowing that self-direction is even an option for them, training and support that's needed, budget authority, misconceptions of fraud. Yeah, budget caps. Great. keep it coming. I'm gonna keep us moving just so we can get to the good stuff with Ohio and Colorado and Val. But I think what you'll see is in chat, many people are experiencing sort of the same challenges. And so when we started this learning collaborative, we looked at what those challenges were, and we also looked at, what are the characteristics of really robust self-direction programs. And so we created a list of what we refer to as drivers for each of the teams. And those drivers are what ultimately were driving us and helping us get to our larger goal of wanting to enhance the availability, quality, and access to self-direction. So the majority of the teams on the Learning Collaborative worked on making sure that systems are in place for self-direction, right? That we have the appropriate infrastructure. So that was sort of the major goal that many of the teams chose to work on. And then second to that was sharing information about self-direction. So getting the word out there, right? Outreach materials, training. How do we really make sure that people are aware of self-direction as an option? And then some teams focused on developing equitable policies and procedures, and finally making sure that there is a good system of direct support professionals, support brokers, and peer mentors for self-direction. So I'm going to take us to our next slide. And so that was just a really brief, very quick overview of the Self-Direction Learning Collaborative. And so now I'm going to turn the time over to Colorado to start us off, to share their experiences in the Self-Direction Learning Collaborative with you, the work that they achieved, and any lessons learned from that experience. So Colorado, please go ahead.
Excellent. Thank you very much. Hello, everybody. Thank you for having us here, having a Colorado team here with you today. My name is Emily Harvey. My pronouns are she, her, hers. I'm a white woman with brown hair up in a bun, wearing a black and white striped shirt with a blue cardigan, sitting in my home office. As you can see, we've got the beautiful backdrop of Colorado on this slide here, and we can go to the next slide, please, Kate. So we earned our badges here in Colorado during this experience. And so we had folks that were from FMS providers or financial management service providers. We had folks with lived experience to be able to share their experiences and how that shaped our work, as well as folks from state agency like myself and Jessica as well. And next slide, please. Our primary driver that we worked on during that 18-month period was driver 1, and that is disseminate information regarding self-direction, its benefits, and how it works. And we really did that through the strategies of that outreach to provide education both to the participants and their family members about self-direction, educating state and local public managers, so those case managers, about the importance and the values of self-direction, creating accessible guides and support, so really looking at the resources we currently have and what would need to be improved upon, and then making sure that again those case managers are prepared to embrace self-direction. It can take a lot of work both for families and for those folks and systems that support them. So we want to make sure that they were empowered with the resources to be successful. Next slide, please. So really what we accomplished during this time is we had to find out where we were. We have been working with self-direction for many, many years, and we had to look at a timestamp and gather the data and analyze that data to really find out what would need to be done and what's going to be the best use of our time. We also were able to do some community partner targeted outreach, and that really consisted of making sure that those folks who would have access to the members that would need these services the most, transitional care facilities, hospitals, places like that, that they understood what self-direction was and that it was an option for people here in Colorado. What is underway is currently in development is a self-direction welcome kit, really looking at how we can best organize all of the resources that are going to be most efficient and how we can get that information out there in the best way possible. So we're currently working on that. And what we're looking for in future state are case manager cafes where folks can have real-time information and access to those folks who can support them. And community educational workshops, again, getting the word out, making sure people have that awareness. That was a big goal of our initiatives here, and that's bringing awareness to self-direction here in Colorado. With that, I will pass it on to Oliver, and he can take it away.
Hi, thanks, Emily. My name's Oliver Giminero. I am a white male. My pronouns are he, him. I have dark hair, short, comb to the side. I'm wearing blue rimmed glasses. I have a dark shirt on and my background is blurred. I have a background in mechanical engineering. So fortunately, when we decided to look at this, I already had a good understanding and a good awareness of data and data analysis. So I think we kind of lucked out on that area. So what we did is we all had assumptions about how we can improve self-direction. We had ideas, but we really wanted to look at some numbers and try to make sure we're making our decisions based on the numbers we had at that moment. Just a little background about Colorado's self-direction. We have 10 waivers, 6 for adults, 4 for children. They cover IDDs and physical disabilities. And there's different models on how they're delivered. Each waiver has one. We have 2 main ways that self-direction are delivered to our clients. One is CDOS, Client Directed Attendant Support Services. And the individual that uses these services has total and most control over their budget, how they have control over their schedules, they have control over who they hire, who they work for. There's another model called IHSS, that's in-home support services. And this is kind of a hybrid model between home health care and self-direction. The home health care the agency helps manage some things, but the consumer still gets to direct their care and determine wages, determine who works for them, but the agency provides some oversight. So when we looked at this, we had a handful of data. We got our data from 2 main places. The HCPF, the Department of Healthcare Policy and Financing, that does our Medicare and Medicaid in Colorado. They provide a lot of data to the public through their website. And then we also receive data from our FMS vendors, our financial management services vendors. We have 2 in the state of Colorado. Some of the things we looked at participant numbers by county. So how many people are participating in these services per county? We looked at caseload by case management agencies. We have case management agencies that oversee our programs. Then we looked at caseload by case manager, so each individual case manager. We looked at allocation. Each client has an allocation that's determined by their case manager. We looked at attendant numbers, and then based on all those different categories, we came up with some different things. So thank you on the slide. So it really, I'm sorry, I'm kind of getting caught up with my thoughts. It was really quite interesting. I'll give our ALS time, cool. We had a lot of assumptions. We thought that the bigger counties would have more participation. We thought might be somewhat related to case manager caseload. We really didn't know what. So when we looked at the numbers, so case manager load, for instance, we looked at case managers and all the case management agencies. Each agency is tied to either one or several counties. And so we looked at the number of CDOS clients, and a lot of this we looked under CDOS. We had a hard time getting information for IHSS. We have about 37, or at least when we looked at this, we had 3,700 CDOS participants, and we had about 6,800 IHSS participants. And so we looked at the CDOS clients by case management agency, and this varied as much. Some agencies have as much as 760 clients, and some as few as 3. And we found out that, and then according to their caseload, some agencies have a high number of case managers. One agency has 108 case managers, and some agencies have few as 1 case manager. So the caseload varied quite significantly depending on how each case management decides to run their program. It was really, so it's really interesting. We thought that some of the larger counties have as many as 760 participants. Some of the smaller counties have as few as 1 participant. We thought that the larger rural or the larger metropolitan cities would have a lot more higher participation rate. And we thought that would be related to them having more case managers. The thought was more case managers would equal more participants. And it turned out that this wasn't the case. Some of the smaller counties had few case managers, a really high caseload, but a really high participation rate. And then that data was backed up by some other things. We looked at individual case managers. We had the data so we could look at the caseload per case manager instead of case manager agency. And a lot of those case managers, same thing. Some of the counties had really high caseload. Some case managers had as many as 50 clients that they oversaw, and some had as few as 1. So we saw a really big variance in case manager load. So that was kind of that kind of went against what we initially had thought. We looked at allocation, which it varied greatly, which that was no surprise because, as everyone knows, there's no one form of disability. There's no one picture of self-direction. Everybody uses self-direction and they're based on their needs. And so that varied quite large, but we expected that. And then we also looked at attendance by member. We looked at the waiver, and then we looked at whether they're relative, non-relative, or a live-in. And this was all pretty well evenly distributed. We did see some waivers, like the some of our IDD waivers had a large percentage of relative care workers, and some waivers had a lot higher rate of non-relative care workers. So that was really spread about. I think the thing that we were most shocked about, and I'm going to go into a little bit now, is on our slide there, the bottom part in red, utilization is really disproportionate throughout the state. It was kind of a shock to see some of our smallest counties had some of our highest participation rates. And they had some of the lowest case manager counts, but they had high participation rates. And after thought and discussion, we thought this might be because there's either lack of home health care agencies, or there's like distance and availability of care workers that affected this. But we saw a huge variation in case manager loads. What we did is we have our participation rate or participation numbers by county. And then we also have people that received Medicaid. We weren't able, ideally, we'd be able to break it down people who are eligible for long-term support services, but we just looked at everyone who participated in Medicaid. Some of those counties had as few as 700 Medicaid participants, and they had participation and self-direction into like 150 people. So that's a huge percentage of that county was receiving self-direction. Some of our larger counties, actually our 5 largest counties, came in the bottom 5 or bottom 8 numbers of our counties. So they had really high Medicaid client caseloads, but they had very low self-direction numbers. And this was not what we first thought. Next slide.
Hi, everyone. This is Jessica Corral. I'm a white woman with long brown hair and glasses. I go by the pronouns she, her, hers, and I am using a backdrop of the Colorado mountains with the HipPuff logo at the corner. So building off of what Emily and Oliver have shared, this NCAPPS project was a really great experience to really assess where our self-directed programs are at and where they could be. We as a team used a few different methods that worked well over the course of the project. One was data collection. As Emily and Oliver have shared, this was really foundational for the work that we were doing. Our participant-directed programs have been in the state of Colorado for over 20 years, so we have access to a great amount of information about CDOS and IHSS that tells us how and where are we successfully implementing our programs, as well as where we can do better and grow. This led us to the outreach project, in which we split up the state to make cold calls essentially to various facilities, interviewing them about their resource referral processes, as well as their discharge processes, and really understanding to what extent they are aware of CDOS and IHSS, as well as to what extent they know the process to get people connected who are interested and eligible. Through that outreach, and I'll mention our hypothesis was that where there is an underutilization of our programs, we might find that our resources to educate people are lacking, either in accessibility or in specific detail to really connect people to what they need to know. Our outreach did confirm this, and furthermore, it clarified for us that there's not just a lack of needed detail within our resources and our information, but the accessibility of these resources needs to be improved, as well as a general understanding about Medicaid and the Medicaid enrollment process and our waivers is really lacking. So we have a lot of work ahead of us, but this project is really key in getting us started. Another method was reviewing our current materials. So all of this information we were able to gather really honed in our focus on our suite of resources and information. So we were able to review where they're located, are they accessible, who is disseminating them, and how are they being disseminated, as well as what is the content included in these resources. Is it enough to meet the needs of the communities we're trying to connect to our self-directed programs. I'll mention that, as Sashka said, there are a number of drivers that we could have chosen. We did initially want to do driver 4 as well, which was the workforce development focused driver. But we as a team really determined early on that to be successful in the work we were trying to do, to set a good foundation of education and awareness, we needed to focus just on that driver 1. And then if we had time to get to driver 4, which we didn't, but it's something that's really important to pick up. Next slide, please. So we learned so many lessons, and I think we also just had a really great time. And this was largely because Sashka and her team did a wonderful job supporting us and creating a lot of good structure around the NCAPPS Learning Collaborative. So huge kudos to them. Some of the lessons we learned were, again, that data piece is so critical. So collecting and assessing the data that we have access to really understand what we wanted to change, what we needed to change is really important, as well as being pragmatic about what we can do now and what we might need to focus on later. Identifying our supports. So understanding the broader stakeholder groups that is connected to us, who's involved and how can they help, and bringing them into the project where possible to support our work, or at least giving them information about what we were trying to do so they could help us spread the news. We also learned that checking in with each other was really important. For Emily and I, this is part of our job, right? We get paid to do this work, and we're so happy to be invited to do it. For Oliver and others on our team, it is a volunteer opportunity, and so capacity is low sometimes, and we need to really understand our constraints, so taking breaks when needed and supporting each other to keep the project moving forward. That was a key lesson. And then finally, committing to the last leg to keep with our theme. I think a lot of us can agree that we can stay in research and development indefinitely because that can be comfortable and less scary. But really change comes from action. And so we learned that being bold and confident in the work that we had done to really put our goals into action and implement them is going to be really, really important. Next slide, please. So our aspirations for the future continue, and the work continues, even though the project has concluded. So Emily and I, in particular, will work very closely with others in HICPUF to find a contractor to develop the welcome packet that she had mentioned. This is meant to be a really concise and portable and accessible resource to not only educate people about self-direction, educate people about CDOS and IHSS, but really give them information about the key steps that they have to take if they're interested and eligible to enroll in our programs. We want to maintain our gains by continuing the data collection and analysis. That's never going to end, and it's, again, so critical to the work that we do. Strengthening and expanding our network of stakeholders and key people who can help us push this work forward. And then also continuing to streamline the materials. We have to make sure that those continually are updated and reviewed for whether they are meeting the needs of our community members as communities change. I think lastly, the goal, as Emily mentioned at the beginning of our presentation, to really get out there in the world, face to face with people, attending state resource fairs to connect with our community members, especially, but other agencies and other staff that can really help promote the principles of self-direction and of our programs of CDOS and IHSS, and get information to these individuals in a really person-centered and in-person environment, ideally. So I'll just end us with, we are so grateful for this opportunity. Everyone on our team And we're so grateful for the opportunity to share with you all today a little bit about what we learned and what we hope to do in Colorado in the future.
Very good. A new frontier for Ohio lies not beyond the planets, but within each of us. Kind of a modified quote from Pierre Trudeau. Next slide, please. This is our crew. Hi, everyone. Before I start, my name is Dana Charlton. I am a white female with short blonde hair, not natural, parted on the side and kind of tucked behind my ears. I'm wearing a dark gray shirt covered by an orange poncho because it's cold here today. My background is blurred, but you can probably see a painting with a brown frame hanging on a white wall on one side of me, and a painting with a white frame hanging on a purple wall on the other side. I was the day-to-day lead during the Learning Collaborative, which started with a crew of 7, but has since increased to 9. Each of us work with a different organization in Ohio, but we're all connected with our passion for people with disabilities having greater choice and control of their services and their lives. And the opportunity to be part of a learning collaborative on self-direction within waivers was something we were very excited about. Our crew included several implementation specialists, Nathan Turner, who's in the middle at the top, and Renee Wood, right under my picture in the second row, are both folks who live with a disability, and they brought lots of lived experience information to the team. Nathan is now with the Ohio State Department of Developmental Disabilities. And another member of our team, Nyoka, who's on the bottom row, is also with the State Department of DD and is an Assistant Deputy Director of Medicaid Policy. So she's the gal that changes waivers and interprets waivers and helps us all figure out how they're going to work with self-direction in Ohio. Both Sharon Travis and Nancy Richards are directors of organizations in Ohio called Councils of Government, and they provide programmatic and administrative support to several county boards of developmental disabilities in Ohio, which are the local system administrators, if you will. And we have 88 of those. Steve Oster in the middle is actually a superintendent of 2 of Ohio's smaller counties. So they brought to our team a lot of local system leadership. And I can't forget Lisa Combs, my co-presenter, who is with the Ohio Association of County Boards and is an advisor to service and support administrators, which is what Ohio labels case managers. Next slide, please. Oh, I missed Jean Stuntz. Jean Stuntz was our data person and is the owner and CEO of a private organization called Dynamic Pathways that provides a lot of training and consultation as well as support brokerage in Ohio. Ohio's team entered the NCAPPS Learning Collaborative with a pretty long history of self-determination and person-centered systems and processes. One of the things that we are very proud of is in the late 1980s, Ohio statute was changed to create something called supported living. This new concept to our state allowed 2 or more people with disabilities not related by blood or marriage to live in their own home and receive government support. The home was prohibited from being provider controlled with 2 exceptions. One, that the owner of the home also lives in the home, with no more than 3 persons who live with a disability. And the second is that the owner is an association of family members and the property is a home for no more than 4 people. All residents of these homes have free choice of provider of services. So it gave people with disabilities the ability to not have to leave their home if they weren't happy with their provider. Ohio also has had a self-directed waiver since 2011. It's called the Self-Empowered Life Funding Waiver, referred to as SELF, and it requires those enrolled to use at least one self-directed service. Other history includes some DD Council projects that provided grant funds to promote things like person-centered planning and supported employment. And in 1997, the Ohio Department of Developmental Disabilities received $1.5 million grant from the Robert Wood Johnson Foundation to support and promote the concept of self-determination throughout Ohio's system. Partners using the grant included the state agency in 4 of Ohio's 88 counties. The NCAPPS Learning Collaborative re-energized Ohio's self-direction journey to include a greater commitment to self-determination with an increased focus on budget and employer authority, self-direction, support brokerage, and supported decision-making. Next slide, please. We started out with a couple of primary drivers and 3 or 4 secondary drivers and realized pretty quickly we had taken on too much. So we settled on just 2 drivers. One was disseminating information about self-direction, its benefits, and how it works. And the second, to recruit and train plan facilitators, case managers, or SSAs in our case, and peer mentors to assist participants to determine the services and supports that they really wanted in their life. Next slide, please. I'm going to turn this one over to Lisa.
All right, we'll see if my camera starts. Dana, thanks. All right, there we
Okay.
are. Hi, everyone. I am Lisa Combs from the Ohio Association of County Boards, and I represent approximately 2,300 SSAs, which are our case managers for people with physical and developmental disabilities in Ohio. Right now, I actually, just to give you a little description of myself, I am a white woman. I'd like to say middle age, as long as I live to approximately 115 years old. So we'll see how that goes. I have brownish blondish hair, also not natural, blue eyes. I'm wearing a burnt orange sweater because it's freezing here, and my reader glasses come on and off as needed. In the background, you'll see a logo that says OACB. That is the association that I work for, supporting county boards. So on that note, we're going to go ahead and get started of what we found out at the very beginning of our when we started looking at how is Ohio doing across the after 10+ years of looking at self-directed services in the self waiver. So we were able to get some data points to get started. We had approximately 1,837 people using at least one self-directed service. That sounds pretty impressive, to be honest. What we found out, though, was that that's approximately how many people we had on the self waiver, which part of the criteria was that you had to self-direct at least one service if you had the self waiver. We also at that time had participant directed, or self-directed personal care on our other 2 waivers, but there was minimal usage of it in other waivers. So really hardly anything. So it was pretty much just represented our one self waiver. We really didn't have a lot of self-directed resources on the Department of DD's website or any of our larger advocacy groups' website. So we had 0 views on it at that point. And we did not have a peer network. One thing we were learning was that, we needed people with lived experience in self-direction helping other people with lived experience find their way through self-direction. So that we could only go up. That's great. I don't know, we're going to keep moving because I know we got time and you guys have great questions. So let's go to the next slide. So how did we start doing? The numbers here are actually a little out of date because they were as of August when our collaborative ended, but we do have updated numbers. What you'll see though, and it doesn't make a huge difference, well, maybe actually most of them are correct, is that we did increase the number of people using at least one self-directed service by 645 people, which is about a 35% increase. Did we do it by all of us, going out and convincing people and training them? Yes. And we also added more self-directed services to our waiver, all of our waivers within that menu. The same time we were taking on the collaborative, we were working with the Department of DD and they were spearheading adding more self-directed services. So we added a service called self-directed transportation to all 3 waivers that we currently have. And we also added a participant-directed goods and services to one of our waivers. So what we saw in our data, that 645 more people using a waiver service came mostly from people in the other 2 waivers that had not been using any kind of services. And many of them were in self-directed transportation and quite a few in participant-directed goods and services. And that's continuing. We're seeing that continue. We have new numbers as of December, but we are continuing to see that trend of an increase. Another really great one is the 12,833 views that we got on multiple different resources that our Department of DD created in coordination with lots of people from our collaborative. We worked on what is self-directed transportation, how do you authorize it? There was all kinds of sessions on that. There was also some sessions on goods and services, a few on homemaker personal care, which, we haven't seen a big growth in that yet. As my association supports county boards across the state, we have a publication that goes out to all case managers, and I was able to commit every publication to have a section in that called the Self-Directed Services Scoop. And in that, I highlighted the training opportunities, the possible views, frequently asked questions, patterns, and trends. And we've done another 5 or 6 of those. So that's an ongoing thing, and that's been very successful. That publication goes out to approximately 3,000 people, most of which are case managers or service and support administrators, as we call them. So you'll see down there that we also note that there was 1,500 SSAs trained. And I would love to say that that's super accurate. I can't guarantee that those are unduplicated. What we did was we really tried to get some leadership from every single county, 88 counties, sending multiple people to trainings, and we collaborated with the Department of DD and our FMS and hosted leadership trainings for people that we could start really digging in a little bit deeper. So that was great. And we certainly had a lot of people in attendance, over 150 or so each time. And we hosted about 6 trainings like that. And those are just now wrapping up, and we are looking at how we're going to improve on those for next year. The other thing that was really exciting for us was the peer network that was developed. Like we said, we did not have that before. So we did end up with 21 people meeting for monthly chats on self-direction. And the name of that group was what happens when I use my voice, or something like that. And it was it's been really good. We found some really great advocates who want to learn to talk up more and how to learn to talk up more. And that's been really helped by our advocacy organizations like Ohio Self-Determination Association being part of this group at large. So we had some really good growth, I would say. There's no doubt that our group has been really excited about the growth that we've seen in self-direction in Ohio. There we go. We renamed ourselves, Dana said, to the Change Makers. So you can see that I missed the last couple meetings. So we are now the Change Makers. But it's been really good to have that group spearhead and offer to speak at various trainings that we do. So we've had a lot of good success there, and that's thanks to Dana and Renee. I'm sorry, Dana. Renee is on our group, and Nate have also done a lot of work for that. Let's go to the next slide, which is the, not so cheery news. We made a lot of progress, but there was also a lot of challenges that we saw. We got into the collaborative after the department and a few of stakeholders were already talking about adding more into our waiver system. So not only were we trying to re-energize self-direction, but we had been in progress to create a whole new service called self-directed transportation, as well as adding our goods and services into a waiver that prior to 2021, it was offered to about 2,000 people. When we added it to our level 1, there was more than 20,000 people with developmental disabilities that would be eligible for that service. That's a big shift. And then at the same time, again, nothing to do with the collaborative, it was determined by our State Department of DD that we needed a new FMS. And we put out an RFP for that, and we transitioned FMSs at the exact same time, July 1, new FMS and new waiver services. That's a lot. Transitioning, adding new waiver services, slow down. That's what we learned. So it definitely was a challenge. I think there were a few other challenges that we didn't list on the slides, that I would just talk about, getting people to come, whether it's people with lived experience or SSAs or county boards, getting them to come to trainings and meetings needs personal, and family members needs a personal invitation. Just posting it someplace isn't always really helpful. Also, just what you guys have said all along, case managers do not have all the information they need, families do not have all the information they need, and certainly people with lived experience do not. So it's an ongoing battle, but it's one that we're really excited that we've gotten so much more views and had so much more training, because we are developing kind of more experts. I think at this point, because of our time, I'm going to turn it over to Dana to talk a little bit about the support, our other big crash and burn, which is our support broker service. Go ahead, Dana.
Yeah, thanks, Lisa. Our biggest disappointment was absolutely no success in expanding the use of support broker services in Ohio. It's a service, it is a waiver service, and it's in only one of our 3 DD waivers. So it does eat into people's budgets. In the fall of 2022, the Department of DD only showed 3 agencies actually billing for support broker services. And there were only about 20 waiver enrollees out of maybe 2,000 who were using the service. We decided to survey all 20-something support broker providers who were certified for the service and see if we could get some information that would help us promote its use. We only got 3 responses, and they weren't real positive. So we decided that we were just going to have to back away from that as part of this collaborative and maybe take it on as we move forward in the future. We do have information about the service on the Department of DD's website. And during the collaborative, as we were monitoring how many views people were, were showing up on the website around self-directed information, we did note that the views on the information about support brokers increased by about 215. So it gives us a little hope for the future. Next slide, please. So though our engagement and connection with the NCAPPS Learning Collaborative has ended, the Ohio Self-Direction team has continued to work together. Current and future efforts include more education, resources, and use of budget and employer authority, self-direction, and understanding its benefits. We want to continue to grow our network of peer mentors. They do meet regularly now, every Thursday evening on Zoom for about an hour. And they're inviting friends to join in, so it is growing. We're excited about that. And definitely we want to improve Ohio's system of waiver services to make support brokerage available to more people. And we definitely want to simplify the provider certification process. Next slide, please. A new frontier for Ohio lies not beyond the planets, but within each of us. Thank you.
Okay, hi, this is Val Bradley. I am a white woman with red hair, not authentic now, but it used to be many years ago. I am wearing a heavy cable sweater, gray and white, since, as people have been saying, it is cold where I am. I'm in Cambridge, Massachusetts. Over my right shoulder is my conference table with a big Swedish ivy that is almost totally taken over the table, and some bookcases behind it. To my left is a glass paneled door and my filing cabinets. So I'm delighted to be here, especially to follow up with these two terrific presentations. And it really shows you the commitment, passion that these two state teams brought to the collaborative. And it's so exciting to see that those of us who pulled together the ideas behind the collaborative, that it spawned such really interesting and rich changes in self-direction. These folks who presented had mentioned something called drivers, and I should mention first that the conception of the collaborative, the template for it, and the template for what I'm about to describe came from trainings that some of our staff went to at the Institute for Healthcare Improvement. So I want to give a shout out to that group. In order to help the state teams to make decisions about where exactly to intervene in their state development self-direction programs, we created something called a change package. And it offered a roadmap to the strategic targets that each team could choose, and then the implementation steps that they could take. We've now turned that roadmap into a guide, which is available publicly through the NCAPPS website. I think either Sashka or Bevan will put the link to that guide into the chat. And I'm going to describe how you can use this particular guide in your own state and your own program to really come up with some guidance around how to proceed, what goals you want to set, and how you want to get there. So next slide, please. So in order to use this template that we've devised, first, and I think you heard this from both of those teams that just presented, you really need to get out and talk to people who have lived experience of self-direction and their families to really understand what the experience has been. Second, you've heard, especially Colorado did a really great environmental scan of their system and found some things that went against their basic assumptions. That in fact, the areas that were more rural in the state were more likely to have more people self-directing per capita. That may be because there are fewer organized or formal resources in those parts of the state. So self-direction was a more attractive option. Anyway, that was a really important step to look at data, to really begin to understand exactly what's going on in your system. And once you've done that environmental scan, it's a lot easier then to select one or more strategies to pursue, then a secondary strategy, and we'll go through these action steps, and then finally being able to measure your accomplishments, which again was something that as part of the collaborative, we really helped states to think about how would they know it if they got there? What kind of indicators, in fact, were there that would be able to tell the team that, in fact, they'd accomplished something? Next slide, please. So the primary strategies, again, based on the Institute for Healthcare Improvement, that we really decided were the key strategies behind any successful self-direction program. First of all, disseminating information regarding self-direction, its benefits, and how it works. And you heard both teams reflect on the importance of really having materials that people can understand, navigate through, that really help them to understand what their responsibilities will be. Also, certainly information to the case managers who are also administering the program. Secondly, a really good package of self-direction policies and procedures that are equitable, transparent, flexible, easily understood, and implemented. And that can be implemented in a systematic and standardized way across the state, so that you don't have a situation where you've got a pocket of self-direction, people self-directing in one part of the state, and then a paucity of people self-directing in another part of the state, hoping that you've got a systematic and standardized practice. Enhancing the infrastructure to support self-direction. Here we talk about how do you develop budgets? How do you make sure that the menu of supports and services in your waiver really constitute the kinds of services and supports people really need in order to self-direct? And finally, being in a position to support people to recruit and train DSPs, being able to recruit support brokers, peer mentors. You heard mention of the importance of peer mentors in the last presentation. So all of the human resources that you need to really make self-direction work. So we asked the teams to pick one of those strategies, at least one, maybe two. I mean, one was certainly enough to chew on. Next slide, please. So the guide now that I'm discussing, which really was the product that the teams used, now we are making it available more broadly. So once a team suggested their strategy, and here the first strategy was disseminating information so that people understood what self-direction was, and then picking a secondary strategy. Developing an outreach strategy, educating state and local public managers, creating accessible guides and supports. And then we ask whatever team has come together to create some reform in the self-direction program to rank order the priorities with the secondary strategies in order to determine where the team really thinks, where the consensus was as to which secondary strategy was important. Next slide, please. So once a group had picked the secondary strategy, we then came up with action steps. Now, we're all pretty smart here, but there probably are other action steps that we missed. But we tried to be as exhaustive as possible, but certainly with any team working with this particular tool, keep open to other possibilities that are more specific to your own state context and environment. So with each secondary strategy, we have action steps. Let's go to the last one here. Ensure case managers are prepared to embrace self-direction. And you've heard from both of these teams that that's where the rubber meets the road. If the service coordinator, case manager isn't really joyful about self-direction, they're probably not going to provide an easy opportunity for people on their caseloads to choose that option. So action steps, survey case managers to determine their level of familiarity and with benefits of the with familiarity with the benefits of self-direction. And solicit their input on obstacles that they encounter. I mean, certainly complexity is a huge obstacle in many states. Conduct trainings with case managers, underscoring that self-direction is a priority, so they understand that this option has to be offered to everyone. And creating a learning community of case managers to grow and enhance their approach to administering self-direction programs. So again, the guide asks whatever team is working on these reforms, again, to rate on a 1 to 5 scale, which of these action steps they ought to tackle first. So it's a gradual winnowing down from the largest strategy to the secondary strategy to the action steps. Next slide, please. So we also encouraged the teams, as I mentioned, to set up some benchmarks for themselves. Again, how would you know it if it happened? So let's again go back to our examples. Strategy 1, disseminate information regarding self-direction. Secondary strategy, create accessible guides and supports. And then a particular action step might be translate materials into common spoken languages that are culturally competent and that reflect cultural practices of target populations. I mean, this is a really important action step because I think we're seeing in many states that families and people with disabilities in the self-direction programs are much more likely to be non-minority, to be more middle class, upper middle class folks. So we really need to double down on making sure that the self-direction option is available to people across racial and ethnic minorities, income groups, etc. So again, the team gets together, they create informational self-direction materials. There's a web page, they create a video that is directed at diverse populations within that state. And then setting some measures, some possible measures, if in fact these strategies, this action step was successful. Percent of people newly self-directing who say they reviewed the materials, a little bit of a cause and effect. Percent of calls, emails, or other communications related to self-direction in alternate languages. Percent of people self-directing by racial and ethnic categories. Et cetera, et cetera. So being able to, with all the effort that is being expended in reforming self-direction, making sure that at the end, you have a way of knowing or ways of knowing that in fact, all that effort created actual change. Next slide, please. Okay, I'm going to hand it back to Bevan. Hopefully we've got about 10 minutes for questions. Bevan?
Yes, thank you, Val. This is Bevan. Thanks, Val. Thank you to our esteemed panelists. So we have gotten a couple of questions in chat, and then we got a lot of questions in the registration, way more than we'll have time to answer, but hopefully we can engage with the panelists and see if we can get some written reflections to questions that we didn't get to. Sent out later on. So I'd like to start with a question that we got in registration, but it also might help to answer some of the questions from in chat related to support brokers. And that question is, based on your experiences, what are key elements that every person needs to self-direct? And for that, I'd love to invite actually all of the panelists to go ahead and turn your cameras on and join me. And I think maybe the Ohio team could start. Would y'all like to speak to what some key elements are that people need to self-direct?
I'll
Sure,
start,
I-
Lisa, and you can jump in there. And
Okay.
we also have some other members of the Ohio team on that might want to add in. I would have to say that one of the things that, and it's pretty basic, but people with disabilities have to find their voice. And it's amazing to me how so many adults who have received services from the system for a really long time just kind of accept what is offered and don't speak up. So I think that's a real critical thing. You have to know yourself, know how to communicate in some way, and have the confidence to speak up to parents and case managers and others in an appropriate way so that people know what it is that you want.
Oh my
Lisa?
gosh. Dana, you got people in that want to be part of Change Makers program. She said she's got a
Cool.
funny
We would
big
love,
mouth for us. So
email me. We would love people from out of state to be part of it. We can learn.
yeah, and that was something we saw in Ohio. Some of the trainings that we did were at our a great conference that Dana's organization and lots of ours at it's called Synergy, where it is very aimed at people with lived experience along with the professionals that work with them, learning side by side about things. And it was amazing to us 2 years running how when we would start talking about self-directed waiver services, particularly, we just couldn't get, they were like, but what does that mean? Right? Like, what does that mean? And we talked, a lot of people were willing to talk about self-direction in the philosophy, just like you guys talked about at the beginning, but they really didn't have a good understanding of how it might be a little different. So I just wanted to make sure that we do talk about the fact that everybody should be, there's no doubt philosophically that everybody should be able to self-direct, but I think that it is part of each state to develop the resources that would support those people, everybody to do it. Because what we're finding with some of our newer waiver services, like participant directed goods and services and our self-directed transportation, is that the service itself could benefit everybody, but there is some responsibility on the person and others to like do some things in between. And if you can't find somebody to help you with that, you're going to have problems, which is why we need more support brokers, why we need better education. But we do have some people that have very few external people in their lives. And so it's like, we really need to help make that a intentional thing in Ohio, at least to really
Right.
help identify who in somebody's life can help with some of these things and what is in the way, having providers that could actually be paid for that in a support broker role.
Yeah. Lisa, I see a question in the chat. Is there a way that self-direction can still work for individuals subject to guardianship? Yes.
Yes,
Absolutely. Lisa and I, and there are 11 of us, again, a different collaborative effort, but we have for the last 2.5 years been working across systems in a supported decision-making network of Ohio. So it involves, the Ohio Department of Education and Lisa and attorneys, Josh Young, who's on this call, who does a lot of work with probate courts and consultations and training around that. So it's definitely self-direction can be part of guardianship and should be part of guardianship.
Yeah, those are actually, we were asked by SSAs on a regular case managers on a regular basis, how can you self-direct if you have a guardian? And we're like, because your guardian can help you. You are allowed to get support. The dilemma we're seeing as we get farther into it is those people that don't have a guardian and they need a lot of support and they're not sure who to identify as that help. And then we look to support brokers or anybody else. So, and I do want to give a shout out to Josh, who put a comment in the chat box about the importance of agencies that are helping with self-direction, really having buy-in and a culture of self-direction. And that is really what Ohio, we've been working on it. It's slow. It's a slow road. We need a lot of success stories to get it going on, I believe. That's one thing we've seen is when we can tell a story about positive outcomes, then we're getting more people to buy in. But that really was our goal, was to work with leadership so that the upper echelon would say, we got to do this. And we're going to continue that, but we also now we feel the need to get to those, all of the SSAs, or at least more of them.
Thank you so
If
much.
any of the others, Colorado wants to jump in about that.
Yeah, no, absolutely would love to hear what Colorado has to say.
Great, and I know we've talked about a few different things, so my brain will go in a million different directions, so please steer me if needed. But what I will say about, the support broker piece is, we are really looking at how we can incorporate that into self-direction here in Colorado, and that really kind of ties in to the opportunities that we have for training and the importance of the various levels of support that each member would need. It's very individualized. So not only in the enrollment process and how they're going to get started on these service delivery options, but also what happens afterwards. What happens is that with that ongoing support that's needed. So we really want to make sure that we can take a look at what our options are and how that can be incorporated in our future state here. And as far as the things that the key elements that folks need for self-direction, again, that training and skill development so that they know, what are the expectations? What might the rules be? What, if they have if they're controlling their own budget, how are they going to utilize that budget? So there is that kind of basic financial literacy as well, and how we can support folks in understanding something that could be this big, hairy, scary thing into some very simple, straightforward steps and expectations on who can support you and how. And so in addition to that, again, looking at that advocacy, knowing who to look to for questions and where you can go to for support. And then that understanding their own goals and preferences. So what is important to that person and what is important for that person? And going off of the question about that guardianship, we in Colorado have a role called the authorized representative. And this is an unpaid support person that the person knows and that can help them if they are either required to have an authorized representative or choose to have one. And there's so many different levels of support that can happen, and it's very much individualized on that person's needs. It's a very critical role in self-direction here in Colorado. With the two types of self-direction that we have, with the consumer-directed attendant support services, that's really where the members, the employer of record, they have all of that budget authority, employer authority. They may need a higher level of support. With in-home support services or IHSS, they have that safety net of an agency, and I loved the way that Lisa described that of just having a culture of self-direction must be there, especially when you're talking about agencies where they might be providing several different types of services or utilizing different service delivery options. They need to know that with self-direction, it's just a different level. They need to be able to have that awareness, that involvement with the member or their authorized representative. And so there's a lot of support and training that goes into allowing agencies to fully understand and embrace the culture that is required for self-direction to be successful.
Wonderful. Thank you so much, Emily, to you and to all of our panelists, Dana, Lisa, Oliver, Val. It's just a pleasure to hear about the good work that you've been doing. I'm so glad that we got to provide sort of a platform to kind of assist you in some small way and energize your wonderful efforts. I do hope that the toolkit that Val shared with you all is useful and something that you take a look at and consider using in your own systems change efforts. If you could, before you go, we'd be most appreciative if you would take a quick 6-question post-webinar evaluation. We use this information to improve our webinars for the future. Thank you for spending the afternoon with us, for sharing your passion for self-direction. We will be back in touch with additional resources and share back some of the great wisdom you all dropped into chat earlier on. And we hope to see you again on our next NCAPPS webinar next week on asset-based community development. Check your email for more information on that. Thanks to all and have a great afternoon or evening.